Joining
Great
us.
to be with you.
Thank you. We're going to get started right now.
Okay.
All right. Wonderful. The photo that I just had up was one of the protests of many that just happened recently, protesting the Medicaid cuts, which is what this is all about today. So good afternoon, everyone, and thank you for joining our virtual Disability Town Hall. I'm Doug Hovey, President and Chief Executive Officer for Independent Living Incorporated, one of 41 independent living centers in New York State, and a member of the New York State Association on Independent Living. I'm honored to serve as your moderator today. And for our viewers, we do have ASL and captioning. This session is being recorded. You'll receive a recording first thing Monday morning as a part of a follow-up email, so that you can share that with your networks. The chat is disabled as an accessibility accommodation for screen readers. At the end of the Disability Town Hall, there'll be a survey which will show up in your browser when you close out the webinar. Okay, so the topic again is Medicaid, and recently the House of Representatives passed a federal proposal that would cut Medicaid by $880 billion over the next decade. While the final version is yet to be approved, these cuts pose a very real threat for millions of individuals and families who depend on Medicaid every day as their primary means of health insurance. And for people with disabilities, these aren't just numbers. This could decimate home and community-based services as we know them. Today, we have an exceptional panel of voices who will help us understand what these changes could mean if such a budget were to pass. We will hear the latest developments in Washington from none other than Senator Chuck Schumer, who's a staunch advocate for protecting the rights of people with disabilities, older adults, and the Medicaid infrastructure. We'll also hear from individuals who have experienced these systems firsthand. We have Bernard Carabeo with us, who is a Willowbrook survivor and founder of the self-advocacy movement. We have Denise Donato, who depends on the Consumer-Directed Personal Assistance Program as her primary means to live independently. And then we have Judy Ginter, whose life depends on critically important services paid for through Medicaid. In addition, you'll hear from Michael Kinnucan from the Fiscal Policy Institute. I'd like to start with brief remarks from Bernard, Denise, and Judy so that we can set the stage for the topic. And then we'll hear from our great Senator, Chuck Schumer. This town hall is not just a discussion. This is a call to action, folks. And at the end of this panel presentation, we'll talk about things that you can do as a way to follow up. So let's start out with Bernard, if we may.
Hi, Bernard.
Hi, Senator. How are you?
Good.
Good. I lived at Willowbrook for the first 18 years of my life. And it was the horrible institution in the country. There are over 5,700 people in the institution. In my building, there was about 300 people in the institution. And everyone had about two or three staff to take care of 80 people. They had to be dressed, fed, shower, and taken to school if they was scheduled to go to school. If not, they sat on the ward all day long with nothing to do but look at TV. We had to look at what the staff wanted to look at. We had no choices in anything. It was horrible. I hate to see Medicaid to be cut, but if they cut Medicaid, we all gonna have to go back to the institution because Medicaid keeps our homes going in the community. And I hate to see us turn back the clock.
Thank you, Bernard. Thank you.
Okay, thanks so much, Bernard. Can we hear from Denise Denoto?
Wow, to follow Bernard, that's big shoes to fill. Thank you, Senator, for joining us on a Friday afternoon. Medicaid, when I was growing up, was always one of those things that you used only if you needed it. You left it for other people, but if you needed it, it was there. My parents were working, blue class workers from upstate New York. Thankfully, we didn't need to use it. We probably could have with 6 kids in our family, but we didn't. But when I became an independent adult, it was pretty clear to me that I was going to need help with personal care. I would not be able to stay at home without personal care, meaning I have people to help me out of bed. They help me shower. They help me get on the toilet. They help me manage my suprapubic catheter for urination. Like, let's talk about the messiness. The messiness that is personal care with Medicaid. That's what people don't like to talk about, but that's the reality.
It is.
The reality is we don't have the beds. We don't have the nursing home beds in New York State if everybody who was seen at home with Medicaid needed to go into an institution. And I don't want to be in an institution. I work. At home, I am a worker. I'm employed. I'm a volunteer in my community with Rotary International and with my former college and their board of trustees. Like, I'm engaged in the world. And that would not be possible if I didn't have Medicaid and if I didn't have my health care that made it all possible and my home care.
Thank
So
you, Denise.
we're all going to hear that and say that, but we're looking to you to be an example for us, to be a fighter, to know that when we say we need this, you're going to say, yes, we do. And you're going to keep fighting for us. Thank you.
Yes. Thank you, Denise.
Thank you so much, Denise. And Denise is an example of millions of people across the country and even New Yorkers. So
Yes.
thank you, Denise, for your story and for sharing. Judy Ginter, whose daily life also depends on Medicaid.
Hi, my
Hi,
name
Judy.
is Judy Ginter, and I actually currently work for AIM Open Doors. I was in a situation where I woke up one morning, I fell out of bed, and I landed on the floor. This is after 5 days of feeling not well and going to the emergency room every one of those days, and they told me I was a pill seeker. Turns out that I actually had a disease called polyneuropathy, which affects all of my limbs. Um, Unfortunately, now I can't cook, I can't clean, I can't do any day-to-day activities. I fall a lot. I am in a situation that is not good, but I am allowed an aid service who helps me very much. I was in a nursing home for approximately 4 months before they said, okay, you can leave now. Well, I had nowhere to go because after all that time, I had lost my savings. I had lost so much, and I had to rely on Medicaid to help pull me up by my bootstraps, so to speak. Medicaid certainly helped me to do that. I currently have an aide who uh, cooks for me. Of course, I'm the chef. I say she's my sous chef. So it's like one of those situations. She helps me clean things that I need done on a day-to-day basis. Thank goodness I can take care of myself hygienically. Um, but the whole factor is that I am totally embarrassed that I had to go to Medicaid and rely on Medicaid for my day-to-day functions.
Thank you.
I would not be here right now talking to you, Senator, if it were not for that,
Yes.
having aid service and etc. So, I'll let the next person speak. I just wanted to tell you I could go on for hours. My mother said, Judy Ginter, you have the gift of gab. And I said,
Okay,
Mom, I took
Judy,
after you.
you've spoken
So
very well, very well.
thank you, Judy.
thank
And
you.
as you can see, Senator, these are
Yes.
three examples of individuals, and
These are
there are so
beautiful.
many, but it's my great honor and privilege to introduce a true champion for New Yorkers and a tireless advocate on the national stage, our senior senator, Chuck Schumer. Thank you
Well,
for being
thank
here.
you. Thank you, Doug. And I want to thank the three people who spoke, all three beautiful people, all three who can live a life of some independence because of Medicaid, because of Medicaid. And I just want to thank everyone for joining. I'm really excited about this evening because your presence on this call, a huge number of people on the call, over 300, speaks to the vibrant, pulsing energy that's spreading across New York and across the country as people start to wake up to the true reality of Trump's radical agenda. And those in independent home care, those in independent living know this best. One thing I'll say at the top, we're at our best when we work as a team, me inside Washington and you all here in New York. We need this inside-outside game more than ever because this call is designed to get us on the same page. As you know, I've worked with the New York Association on Independent Living for many, many years, and I've worked relentlessly for the rights of the disabled, New Yorkers and elsewhere, because I believe in you, and I believe in who you are and what beautiful people you are. But rarely have the stakes been higher than in this Medicaid fight. I'm coming to you right off the Senate floor. We're engaging in a big legislative battle with Republicans to slow down their agenda. I'm going to talk tonight about the central piece of the Trump legislative agenda, the Republican legislative agenda, gutting Medicaid and other critical programs. And why are they doing it, folks? One selfish, nasty reason: to give bigger tax breaks for the billionaires. Imagine taking away the independent life of the people we've heard of, and so many other millions. So billionaires who have a lot of money already can get a tax break. It's disgusting. And right now, the Senate Republicans are working on Trump's agenda. Some of them know it's wrong, but they're afraid to buck them. So we're going to talk about what this plan is and then how we can stop it, because that's been my assignment. So we're already seeing some Republicans in the House and Senate struggle to agree on a path forward for this so-called mandate of Trump, passing this radical agenda that would slash Medicaid and hurt you. We have to remind ourselves again and again that nothing about this agenda is inevitable, and it's certainly not popular with the American people. Cutting the taxes of billionaires and paying for it by destroying Medicaid is not popular. And Trump is relying on the fact that the public isn't paying attention to try and ram it through before we can stop him. But folks, we can win this fight. And I am totally on your side to win it because I believe in you and I believe in Medicaid, and I push to increase Medicaid all through the years. Now, the process we're doing is called reconciliation. And the problem is they only need 51 Republican votes to pass it. They don't need any Democratic votes in the Senate. We're all united against it. But right now, the House and Senate are disagreeing about it, and that's good for us. Republicans are trying to paper over their enormous differences because there are some of them who don't want to cut Medicaid the way Trump and Musk and Doge do. There are some of them who are more moderate and they understand how politically damaging Medicaid cuts would be. But then there are some on the right wing who think these cuts aren't even enough, if you can believe it. They want to cut $880 billion out of Medicaid. And that means kicking people off coverage, cutting services, lowering payments dramatically. And this is going to squeeze all parts of the healthcare system. So Republicans got to feel the heat. And I don't like to make this partisan, but that's the fact of the matter. And we're fighting for our survival here. So you have to tell the truth, tell truth to power. So we've had some senators come out and say they can't support a bill that will kick people off Medicaid or cut benefits. Our New York Republicans have stated, there are 6 of them in the House. We have 2 Democratic senators, so we're all with you. But they've stated they're worried about Medicaid cuts. So the conversations that you have already had with our colleagues are working. We need to keep it up. Tonight, we'll be putting more pressure on Republicans by voting on amendments as part of an overnight, what's called vote-a-rama. It's a ton of votes, and it includes amendments against ending people's Medicaid cuts, including for people with disabilities, and amendments against cutting Medicaid benefits or payments to states. We saw some Republicans break with their party and vote for it last time. So we're driving a wedge between the few Republicans who might vote with us. They're not a done deal, and showing that this plan can't include anything that cuts Medicaid. I am against 0 Medicaid cuts. And I put in an amendment that said no billionaire gets a tax break if they cut a single dollar out of Medicaid. No billionaire gets any tax break if they cut a single billion out of Medicare. So where does New York AIL come in? Where do you come in? You can really be helpful here, and that's why I'm so glad we've done this call together. We need you to mobilize in every way to draw attention to the specific impact, the beautiful stories that you have told me, the 3 folks who are on the line. How can you make sure Americans understand these cuts are so bad? Just speak about it. Speak about your dignity. Speak about your freedom. Speak about what happened before there was Medicaid and people were in these horrible situations. And talk about how it's so your right is like anyone else's right to live freely as possible in the community, not in nursing homes. And that's essential for disabled people. We need to let Americans understand it. Medicaid allows for people with disabilities to live full, free, and rich lives. You're as entitled to it as anybody else. And I've always believed in that, and I'm fighting for it right now as I've fought for it every day in my career. So we have to tell that story. But being New Yorkers, you can be in a pivotal role to help here, because the Republicans in the House only have a vote margin of 3 votes. So if we could get 3 Republicans to vote with us, I'll make sure all the Democrats vote for us. We could block these cuts. We have the highest concentration, one of them of Republicans in the swing districts. So if New Yorkers can make their state so outraged that it becomes impossible for just 2 or 3 of these to vote against Medicaid, we can defeat it and slow Trump's momentum. We have some of the best organizers and activists in the country right here in New York. We have a rich civic infrastructure. So I want New York advocates like you to show the rest of the country what an aggressive resistance can look like. It looks like direct action. Call your representative directly. Don't just you call, have your family call, have your friends call. They want you to live these good, independent lives. Have them call. And it looks like tapping into your network. If you have a local PTA, a local church, local county official, local hospital executive, you should all, as best you can, be on the phones calling people and saying, don't cut, and tell them your group, Independent Home Care and New York Independent Living will give you the names and phone numbers of the people to call. And that's who you should call. It also looks like telling your stories to the media and going on the social media. The same story I heard, I hope we can see on Facebook and Instagram, and loads of people can see it, because any human being is going to have total sympathy, any decent human being, for where you're at. So the strategy here is very simple. We have a unique opportunity, and we should do everything we can, calling, writing, organizing, telling stories, to the Republicans. I want New York Republicans who are considering voting for this bill to feel political pressure. They're going to want to hide, they want to be silent, they want to be accountable. But you can't tell, you have to tell them and the media you talk to not to vote the way we want. And they can't say, oh, I'm for you, but the vote's going the other way. They have to vote against the big bill that cuts Medicaid. Yes or no? Yes or no? We're already beginning to see the signs. Trump's polling is going underwater. He's dropped from +8 last month to being negative now because people realize how badly he's hurting them. Trump's own pollster recently showed that on health care, particularly, Republicans are in trouble in competitive districts if they vote with Trump and against you and me. In town halls, Republican members of Congress are facing a backlash. So folks, I want to conclude by saying this. I believe in you. I believe in you. But you can help me. I'm on the inside pushing them. But if they hear pressure from the outside, if they hear from you and your family and your friends that this cannot happen, and you're going to be watching and holding them accountable, we can win this fight. And the beautiful lives that Medicaid has enabled you to live so far will stay. I am totally committed. And one thing I can promise you, I'm not going to be outworked. I'm going to be relentless on this. I'll conclude by telling you a little story about my dad. My dad had a junky little exterminating business. He struggled his whole life for 50 years, but he retired, and he never complained when he retired, and he passed away 2 years ago. But he taught me 2 values, and those of you who have had parents who you've lost recently will know what I mean when I say he's sitting here right next to me, guiding me. And he taught me 2 values above all, folks. First, always help people who need help. The more they need help, the more you should help them. That's why I do what I do. That's why I do what's so much for the disabled and everybody else. But second, he taught me this. He said, if you're doing something important, look into your heart. Make sure it's the right thing to do. And once you're sure it's the right thing to do, persist, persist, persist. Don't give up, and God will reward you and you will succeed. Together, my friends, we will persist, persist, persist. Never give up. And if we stick together and fight hard, we can succeed. God bless you. And I look forward to many more years working with you for the betterment of people who are living independent living and independent home care, folks.
Thank you, Senator, for being a champion in this fight with us. Thank you so much.
Thank you. Great to be with you. God bless you all.
God bless. All right. Very good. We always know that we have an ally in Washington and here in New York in Senator Schumer. Okay, so next up would be Michael Kinnucan, who is with the Fiscal Policy. Michael?
Hi, thank you. Yes, my name is Michael Kinnucan. I'm the Health Policy Director at the Fiscal Policy Institute in New York. We cover New York State budget and policy and work to show how important programs like Medicaid are for New Yorkers. I'm going to share a quick presentation that I made for this call about what Medicaid does for New Yorkers and what Republicans are trying to do to Medicaid in New York. And I think this is important to say because for a lot of politicians, Medicaid is an afterthought. You know, everyone understands how important Medicare is. They all expect to be on it someday, but a lot of people don't think they're ever going to need Medicaid. They don't see it as important, but it's a crucial program. Medicaid is the largest single source of health insurance for New Yorkers. There are 7 million New Yorkers. Out of 20 million people, 7 million are on Medicaid. So that's 35% of the population, right? And a lot of those people are low-income people who don't get insurance from their employer, or they don't work, or their kids, or and they just get health insurance, right? It pays for doctors, it pays for hospitals. That's right there is 5.4 million people, more than a quarter of New Yorkers rely on Medicaid for health insurance. But then Medicaid does another really important thing that a lot of people in the country and in politics don't know about, but I think most people on this call do know about, which is that Medicaid is the only public program that covers long-term care for people with disabilities and for older adults, right? So if you need long-term care beyond, hospitalization, beyond a doctor's visit, Medicare typically doesn't cover that. You rely on Medicaid, and that applies. So what that means is that a lot of people who think they're never going to need Medicaid and it doesn't apply to them because they make a lot of money, they'll someday have the story like some of the ones we heard earlier today, right? And they will find that they get to a certain age or they have an accident and they do need that long-term care and they do need Medicaid. Now you can see most of the people who are on Medicaid, they're getting health insurance. It's that 5.4 million. But there's another group of people who are using Medicaid for long-term care. Maybe they also use it for health insurance, but maybe they actually have health insurance through Medicare. And they use Medicaid for long-term care. And that just by itself is a huge number of people. So Medicaid provides home care for nearly 400,000 people in New York State. And that's a big part of the spending on Medicaid, right? So that's $20 billion out of the state budget is going to support home care. Medicaid also provides community-based services for 110,000 people with intellectual and developmental disabilities in New York State. And that's a program that costs $10 billion, right? This is a huge, huge portion of the program. There are 1.2 million Medicare enrollees who are also Medicaid enrollees in New York, either because they need long-term care or because they just need help paying for Medicare premiums and copays and so forth. Being on Medicare can be expensive, and so Medicaid helps with that. So this is a big group of people. And here's what I want to emphasize. Actually, most Medicaid spending goes to support older adults and people with disabilities, right? So what this chart is showing, you got the breakdown in terms of enrollment is the blue is adults and children, and 78% of the enrollees in Medicaid are adults and children who don't have a disability and they're just using it as health insurance. And then the remainder of enrollees, 22%, are older adults, people with disabilities. But if you look at the spending on the program, it's actually tilted just the other way, where most of the spending in New York State on Medicaid goes to support people with disabilities and older adults, 59% of the spending. And that's really important to keep in mind as we talk in a minute about Republican budget plans, is that they're saying, well, we don't want to cut services for people with disabilities, we don't want to hurt the elderly, we want to just for people who don't deserve Medicaid, they could get a job and get health insurance. Those are the people we're attacking. But you can't attack Medicaid without attacking older adults and people with disabilities, because that's where most of the money is spent, right? That's where the investment is. And so any cutback in Medicaid, it's going to hit those people first, right? Older adults, people with disabilities. So let's talk about how Medicaid is funded. And I apologize, this is a little bit of an ugly pie chart, but what this shows is where the money comes from for New York State's Medicaid program. So last year, New York spent about $103 billion on its Medicaid program, right? And again, more than half of that on services for older adults and people with disabilities. And that funding comes from three different sources. A little bit of it, about $8.6 billion, comes from county governments. And then the next bigger chunk, this blue chunk on my pie chart, $37.7 billion comes from the state. So we pay state income taxes and other sales taxes, and that money funds some of Medicaid. But then the third piece and the biggest piece is $56.8 billion a year from the federal government. because that's how Medicaid is supposed to work. The state spends and the federal government matches that spending. And that's most of the program, right? 55% of the program, almost $57 billion. That is the source of funding that's under threat from Republicans. And how much of a threat? Well, as Senator Schumer said, Republicans can't even agree with themselves about how much they want to cut Medicaid. But House Republicans voted for a budget plan, about a month ago that would cut $880 billion nationwide over the next 10 years from the federal contribution to Medicaid. In New York, next year, if that budget passes, it's going to cost the state $6.7 billion, right? So that's that's more than a 10% cut to the federal contribution. And that's not even the last of it. Cuts will grow over time to get to that full number that they want to achieve. It will be a really serious burden on New York State taxpayers if we want to protect these services, which we certainly should. And it will push the state to cut back on services for older adults and people with disabilities. It's a really dangerous plan. Now, I saw in the chat some people had the question of who specifically are Republicans talking about cutting off from Medicaid, right? And it's a really good question because, frankly, there isn't a really good answer. Do they want to cut children whose parents don't have health insurance? Do they want to cut people with disabilities living in the community? Do they want to take money away from Medicare recipients who need help with copays? They haven't provided clear answers on this. They've said, okay, they want to impose a work requirement for some people who should be working. We know how that goes. We've seen it across the country. When you impose a work requirement on Medicaid, it just creates a paperwork hassle that causes people to lose their benefit, just by not getting the right piece of mail or whatever. But it doesn't save any money. I mean, most people on Medicaid, they're either already working or they're not able to work. And so it doesn't save any money. Other than that, they haven't said, who do we want to kick off Medicaid? They've just said, we're going to give less and less money to the states. We're going to cap the federal contribution. We're going to cut it. We're going to change the formula. So the states will have less money. And then good luck, basically, right? The states can figure out whose service they want to cut, whose wage they want to cut, whose eligibility category they want to shrink. That's the plan, is to a little bit hide the ball, right? These numbers, they're just numbers, and the human cost of doing this kind of cut will be someone else's responsibility after the next election. They also argue they're going to save money by cutting waste, fraud, and abuse. There isn't $880 billion of waste, fraud, and abuse in the Medicaid program. We know that. Frankly, they know that. Again, it's just a matter of not being open about the plan, because the plan is unpopular. People know that everyone has a right to health insurance and that everyone deserves to be able to live in the community. People don't want to vote for someone who took that away. And so that's why they're not being totally open about what their plan is. But we should be very clear, and we should, Senator Schumer said it, we should be telling everyone at every opportunity, everyone we speak to and sharing our stories, that Republicans are not going to be able to cut Medicaid the way they're talking about without taking the pound of flesh out of people with disabilities and older adults. That's what the program is for. It's where more than half the money goes, is to enable people to live in their communities, to age with dignity. And if you start chopping at the program, those are the people who are going to get hit. And so that's just the important thing to grasp, right? Is that it's not a matter of finding out if they're going to cut your program or my program that I depend on or you depend on in particular. It's about the fact that when there's less money, everyone's going to get hurt. Everyone's going to see their programs threatened, the services they depend on cut back. And so that's what we need to fight. And that is the end of my presentation. Thank you so much for hearing me out, and I'll stay on for the discussion.
Michael, thank you for a very informative overview. There's some of the data that I was not aware of myself, and having worked in the Medicaid industry for many years. But yeah, we've got a major threat on our hands. There's no question about that. The threat to home and community-based services, the waiver programs. Can you comment at all on the potential impact, Michael, on the waiver programs here in New York State?
Yeah, absolutely. I think, and so you're thinking of OPWDD comprehensive and the children's waiver and TBI and NHDD. Yeah. Yeah, again, the Republicans have not chosen to be specific about whose services they want to see cut back, but I think it's enormously concerning, especially for those smaller programs that might not have the scale of constituency to politically defend them, right? If the state has less money, then the New York State Legislature is going to be up there next year, facing a really tough decision about how to find $6 or $7 billion or $8 or $10 billion in savings, and whether to take it from schools, from roads, or from our programs. And I think there's a really significant risk, especially, frankly, given the skepticism of some folks in state government about these programs, the efforts to cap NHTD and TBI. There's a really serious risk that they will see those as the place to save some money. And so we should be really concerned about that.
I also know that many of our voc rehab services receive a significant share of federal funding, and they're at potential risk on a broader scale of moving to an order of selection, let's say. And while I know that the community first choice option is not it's not a waiver program, but it certainly is in the line of fire should these cuts come to fruition.
Yes, that's right. So community first choice option essentially gives the state a higher federal match for certain services that allow people to stay in their communities. Instead of kicking in the standard 50%, the federal government kicks in 56%. If that got cut back, that would be a really serious concern. I want to say one more thing about the federal match, because so when the federal government expanded Medicaid to the new adult population, to people between 100% and 138% of the poverty line, in order to get states to accept that and do that expansion, the federal government gave states a really high match on that program, 90%, right? That was the only way you could get Republican states to even take it at all. And that match is still there. And one talking point Republicans are using is they're saying, oh, why should these adults who don't have disabilities, who aren't elderly, why should they be getting that good match while, the traditional Medicaid beneficiaries get a lower match? We're going to cut back that 90% match to a 50% match, which would cost New York State $10 billion a year. And we're saying, well, that's fair. Why should those adults get higher matches than people with disabilities? And let me tell you, that is a really dishonest argument, because it doesn't matter who the match goes to. If New York State's budget and availability of Medicaid funds gets cut by $10 billion, we will all get squeezed, right? So an effort to say, oh, some people who are on Medicaid, maybe they don't deserve the money or they deserve less money, that's going to impact everyone, because it's going to put the state budget in a horrible crunch that will force really tough decisions about who gets cut.
Excellent. Yeah, thank you, Michael. One other thought as we're having this conversation is the Olmstead of the most integrated setting law and the potential impact on that. I mean, clearly there would be significant fallback and we're talking about rolling back a Supreme Court decision in effect, whether you say directly or indirectly, but this would be huge. Can you just comment on that potential impact?
Yeah, I think a lot of us on this call know that living up to the obligation of Olmstead costs money, right? And so whether the decision is rolled back judicially or whether the actual impact of it is rolled back legislatively because there isn't the money to actually allow people to live in the least restrictive setting. Either way, I think that's an enormous concern, and I wish I could say that I hoped that the Supreme Court or other courts would do something about it and prevent these cuts, but not with this Supreme Court. I think what we need to do is tell the, 5 Republican members of Congress from New York State who have the margin. If they all voted against this budget, it wouldn't pass. We need to make it really clear to them that they won't be reelected if they vote for this.
Great. Great. Thank you, Michael. Appreciate all of your presentation and your comments. I want to turn now to Bernard and to Denise and Judy to see if they have any final comments before we move to our final closing, which we'll talk about a call to action and steps that the audience can take. We can all take together collectively. So, Bernard, any final comments? Or Denise? Or I'm sorry, there you are, Bernard. Thank you.
I'm right here. Yeah, the state Republican people, they talk about the anti-abortion, but when we come into the world, you don't want to take care of us. God, you can't have your cake and eat it too. I mean, come on, don't be hypocrites. We got people to take care of. The hell with the rich people, they can take care of themselves. We need to take care of real people that are struggling. And I don't want to go back for an institution. But other than that, I don't. I got beaten almost every other day. I don't want to go back to that again. Thank you.
Great. Thank you, Bernard. Denise?
Thanks. This week, me and I'm supposing a lot of other people, I've been head deep into PPL and the fight for consumer-directed personal assistance. New York State is moving to one single FI, and that destroys choice, which is the epitome of self-direction. And I don't want to sideline this topic by going off, but I think we need to acknowledge the elephant in the room that many of us are fighting for our home care right now, trying to manage change to a system that's not ready for us yet. I keep being told I'm not authorized for services when I know I am. And I'm with it. I know this program, so I just can't imagine how many people are falling through the cracks on this. But the only way for us to fight is to come together. We can't be in silos, fighting for OPWDD over here and CDPAP over here. No, we need to fight united as a disability coalition. ADAPT did things because they did things together. The documentary on the Capitol Crawl that was shown on PBS last week is a great documentary, and we should all be watching it to learn more of our history. We should be talking to Anita Cameron and some of our peers, Julie Farrar, about their experiences, because we need to take care of each other. As Bernard says, we need to take care of each other. Nobody else is going to take care of us. We need to depend on each other. Now
Absolutely. And thank you so much, Denise, for bringing that up. How can we have, an hour-long conversation about proposed Medicaid cuts and not talk about, as you put it, the elephant in the room, the consumer-directed personal assistance model, which is founded on the belief that people with disabilities are in control and in charge of their own services and their own lives. There's a court arguments today where Judge Block ordered an extension of the TRO, the temporary restraining order, until next week, where and the hope is that the plaintiffs and the defendants will come to terms and come to an agreement. We're not convinced that will happen, which would put that back in the judge's hands to make a decision about where to go here. But one of the, I think, critical components of this, and one of the major frustrations for all of us, has been, the definition of completed enrollment, right? How do we define that? What is a completed enrollment? Because people right now just don't know. I mean, whether you're a consumer or you're a worker, they don't know their status. When you're told, oh, your enrollment has started, so you need to receive services from PPL. Well, what does that mean? Your enrollment has started. The bottom line is, our workers going to get a paycheck on April 10th. So I keep saying, the next doomsday, so to speak, is, all right, let's hope it's not a doomsday, but we don't have a lot of confidence right now just because the system has not been working. The payroll comes out next week, and we'll see how many people actually get a paycheck. So we're hoping that good news will come out of next week's revisit by the courts, and hopefully make some longer term adjustments for the program. Okay, great. I know there are a lot of questions about the CDPA. I've seen them coming up on the screen, and that's really the long and short of it today. As far as the CDPA program goes. Folks, can we move into next steps and actionable items that we can do now as a collective, a disability movement in New York State? Obviously we want you to stay connected. So, join a march tomorrow. There is several marches going on around the state and around the nation, protesting Medicaid cuts. Connect with NIAL. Sign up for the NIAL alerts if you haven't already. The New York Association on Independent Living. It's ilny.us/NIAL-newsletter. Again, it's ilny.us/NIAL-newsletter. And you may also want to reach out to your local independent living center to see what, in fact, they're doing, and they can also help you get connected to broader audiences and protests that are happening around the state. But you can also sign up for alerts through the National Council on Independent Living. They are actively working to support protests around the country and to oppose these cuts. And then, of course, contact your representatives in Congress and tell them to protect Medicaid. You can look them up online, and I'm sure many of you have already done that or are connected to your local congressional leaders, but that's critical. As Senator Schumer said earlier, they need to hear from us. We need to be the movement. We need to be the change that needs to happen to prevent these cuts from actually happening. Michael, did you have any other final comments or suggestions about activities?
No, just I think, as someone who has worked for a couple of elected officials, I'll just say that if an elected official gets 8 calls about something on a given day, they freak out. We shouldn't underestimate our power here. We shouldn't underestimate how we can destabilize this. And frankly, people with disabilities have been central to protecting this program for decades. Medicaid wouldn't exist in its current form. Older adults wouldn't have home care without the disability rights movement, because it's really, 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 really hard for politicians to look people with disabilities in the face and say that they don't deserve care.
Absolutely.
And so we have a really important role to play here.
I could not agree more. And to any of my colleagues in the chat room, any comments, final comments?
My name is Judy Ginter, and I am a panelist.
Judy, I'm so sorry. I meant to get to you and I got sidetracked.
Okay.
Forgive me. Please,
That's
yes.
okay. I felt kind of left out. I was like, what? Come on. No, actually, it was AIM Open Doors that helped me to get out of the nursing home. I was not able to get out of there unless you already have a place to move to. Well, when you're in a nursing home and you've worked all your life and then you're in a nursing home for 8 months, of course you lose your job and there was nowhere to go. So I have to give big kudos to the AIM Open Doors program that allowed me to get out. I currently now work for AIM Open Doors program. I am a peer advocate. I talk to people that are in nursing homes, and work with transition specialists to figure out the best way to get them um out of the nursing home. It it's very hard when you hear someone that was in the same situation as you and they are stuck like Bernard was. Um, Unfortunately, it happens more than you would think. Some of the people I work with, most of them are all mentally capable of getting out, but they have nowhere to go. So the nursing homes will not release them. Now, with me, they kept me in the nursing home because they had nowhere to release me to after a certain amount of time. Um, they just put me on the dementia floor. So I lived up with dementia patients for about 3 months. And it was good, it was bad. It was a big lesson on respect for other people and what could happen to me or you, to anyone. I mean, I just fell out of bed one day, and next thing you know, I'm in a situation that's a bad one. So I just wanted to add that
Thank,
anyone, it could happen to anyone at any given time.
well, th
So Medicaid was my savior, and also some of the different programs that Medicaid supports. Thank
excellent.
you.
Thank you, Judy, and please, yeah, keep telling your story. It's very impactful, and these are the stories that our leadership in Washington and in New York need to hear. I do want to also, I want to acknowledge that there are an awful lot of questions, and we'll do the best that we can to review them and answer them via email. A lot of them are similar in nature, but they're we had well over 100 questions and we couldn't get to all of them today, but we tried to address as many as we possibly could in our comments and presentation. So again, I want to thank you all for being here today. As I said earlier, remember this is not just a town hall, but this is a call to action. We need everyone to get activated and sort of join the movement if you're not already involved. So thank you so much for being here today. And I'll just close with that. Thank you.
Thank
Oh,
you, Doug.
yes. Oh, before, really quickly, this is Blaze here. Remember, there's going to be a survey that pops up in your browser when you close the webinar out. If you please could take a few minutes to fill that out. This is for two reasons. Number one, it has some action steps that you can take to protect Medicaid. And number two, this is a good way to gather feedback, what you liked and what we could be doing better. And again, if you didn't have a chance or if you don't have a chance to fill it out now, I will include that in the follow-up email that you will see in your inbox first thing Monday morning. This was a phenomenal team who put this all together, and thanks to Senator Schumer, who has since left, Denise who has since left, and Judy and Bernard, thank you for being here as panelists, and to the amazing crew here, Evan, Heidi, Joe, Doug, Alex, for helping put this all together. And of course, lastly, to you as attendees, we could not do this without you. So
Thank you, Blaze, and thank you to Niall and the team there who really did all the behind the scenes work of coordinating this event. So thank you very, very much.
thank you. Have a great weekend. Be well.